Assalamu alaikum, everyone. Thank you all for joining, and inshallah, everyone is doing well. And of course, staying at home. My name is Nergis Ali, and I'll be moderating today's webinar titled What You Can Do to Flatten the Curve. In these unprecedented times, it is imperative to understand how we as a community can play our part to help stop the spread and save lives. I am pleased and thankful to be with you all tonight and to have the opportunity to introduce our wonderful guest speaker, Dr. Annie Kizilbash. Dr. Kizilbash graduated from Aga Khan University from medical school and did her residency in internal medicine from Emory University in Atlanta. She went on to do her fellowship in infectious disease from Baylor College School of Medicine in Houston. Additionally, she attained her master's of public health at UT School of Public Health. Dr. Annie Kizilbash is currently the medical director at Texas Center for Infectious Disease in San Antonio. She also is a medical consultant for Heartland National Tuberculosis Center and an associate professor in internal medicine at UT Health Northeast. Without further ado, please help me in joining Dr. Annie Kizilbash to enlighten us on what we can do to flatten the curve. Additionally, I also want to mention to the viewers that please put their questions in the YouTube chat, and we will, in the latter part of the webinar, address your questions. Thank you.
Okay, so Assalamu alaikum, Bismillah ar-Rahman ar-Rahim. Firstly, I wanted to thank the Islamic Center of Momin for inviting me to talk about COVID-19 and what you can do to flatten the curve. I wanted to begin with a dua by Prophet Ayub, who is known as Prophet Job in English, from which we can draw some inspiration in a time like this. As you know, Prophet Ayub was affected by a terrible skin condition, which was not only painful, but also disfiguring, and even his friends and most of his family abandoned him. He recited this dua, which can be roughly translated as, "Indeed, harm has afflicted me, and you are the most merciful of all those who show mercy." Allah listened to his plea, and he told him to strike the ground with his foot, and a spring of water gushed out when he did this. He bathed in this water and was cured of his disease and restored to good health. In this COVID-19 pandemic, it is crucial to remember the importance of making dua to Allah. Okay, so although we are surrounded by social media and people who talk about COVID-19 all the time, and it's important to remember that throughout history, as humans have spread across the world, infectious diseases have been a constant companion. From the time of the Black Death, you can see here in the 1300s, where 200 million people died from it in the medieval ages, followed by smallpox, which killed 56 million people approximately. And then more recently, in the early 1900s, the Spanish flu, which killed approximately 40 to 50 million people. And more recently, we had the AIDS epidemic, which killed approximately 35 million people to death, to date. Of course, our most recent pandemic is COVID-19. And, although it's certainly not the first pandemic that we've had, and probably won't be the last either. Okay, so just a brief introduction to coronaviruses. So coronaviruses are RNA-containing viruses that have commonly circulated among humans for many years and are responsible for about 25% of all common cold illnesses. They do not usually cause serious disease. The virus causing the disease, coronavirus disease 2019, or COVID-19 as we now know it, is actually called SARS-CoV-2. And this is not the same as the coronaviruses that commonly circulate among humans and cause the common cold. SARS-CoV-2 is a novel coronavirus, and that just means it's a new coronavirus that has not previously been identified. Oh, and I wanted to mention June Almeida, and she is actually the lady who discovered coronaviruses back in 1963. And this was while she was working at St. Thomas's Hospital in London. Okay, so SARS-CoV-2 is similar to SARS-CoV, which caused the SARS outbreak in 2002, and also is similar structurally to MERS-CoV, which caused Middle Eastern respiratory syndrome. Coronaviruses are not only found in humans, but they can be found in animals as well. And bats are just one of their natural animal reservoirs. It's thought that somewhere in late November to early December 2019 in Wuhan, China, SARS-CoV-2 spread from bats, most likely via an intermediate host, probably pangolins, to humans. And here I have a photo of a pangolin, and these animals are actually widely hunted because of their scales, which are thought to have important medicinal properties in traditional Chinese medicine, and they are used to cure all kinds of ailments. Okay, so looking at the COVID-19 dashboard from Johns Hopkins University, you can see that today, the total number of confirmed cases of coronavirus exceeded 2 million. And there's been over 128,000 deaths which have been reported. And the US currently is leading in terms of the number of confirmed cases, over 600,000 to date. In terms of the cumulative total number of COVID-19 cases, you can see that, as expected, the number of cases has been exponentially increasing since mid-March. And this is partly because of increased lab testing and reporting occurring across the country, in addition to community spread. The total number of deaths which have been reported in the US from COVID-19 is 22,252 as of this morning. Okay, in terms of states which are reporting cases of COVID-19 to the CDC, as we all know, New York has been heavily affected. Other states such as Florida, California, Louisiana, and our state of Texas has been affected as well, with over 5,000 cases. If you zoom in on Texas, you can see there's been approximately, this number keeps evolving so rapidly, but there's been, somewhere less than 15,000 cases reported so far. And of this, there has been 318 fatalities. And many of the counties in Texas have been affected. And you can see leading in terms of numbers is Harris County, followed by Dallas County, then Tarrant County, and then relevant to us here in San Antonio, Bexar County, in which there have been 794 cases to date. Unfortunately, the daily number of new cases is also continuing to rise at this point, and it has not leveled off. So the earliest, when I checked earlier this morning, the data that we had from the 10th of April, you can see that the number of cases has continued to increase on a daily basis. Okay, so I'd like to turn your attention to healthcare systems in the US and why this is important. So usually healthcare systems in a country work near full capacity in terms of the number of hospital beds which are occupied, ventilators which are in use, the number of healthcare workers, as well as personal protective equipment, or PPE, which is needed by healthcare workers to take care safely of these patients. Personal protective equipment includes masks, gloves, and these gowns that this healthcare worker is wearing over here. Even if there is a small increase in the number of cases of disease for a hospital, such as in this coronavirus pandemic, this can quickly overwhelm a healthcare system. Due to healthcare workers having inadequate PPE, many hundreds of healthcare workers are currently ill or quarantined. ICU beds have started to run out, and ventilators are in short supply. The two strategies to tackle this problem are firstly, flattening the curve, and secondly, raising the line. Okay, so what does it mean when we say we want to try to flatten the curve? So this, on flattening the curve, the focus is on diminishing the number of people who get sick from COVID-19. And why is this even important? So say if, in the US, over a 2-year period, 200,000 cases of COVID-19 were to occur, and I'm just throwing that number out there. If that happened over a 2-year period, that is very different from the same number of cases occurring over, say, a 1 or a 2-month period. Even if the same number of cases occur over a longer duration of time, our healthcare systems will then be able to not reach their full capacity, hopefully, and be able to look after those patients who do need to be hospitalized with COVID-19. Now, the other strategy to tackle COVID-19 would be to raise the line, which means to raise the healthcare system's capacity to look after patients who need to be hospitalized. But unfortunately, the public can do relatively little in order to improve this situation. There are a couple of things that the public can do, and we will go over this in subsequent slides. Okay, so it's important to know how the disease spreads, right, in order to hopefully decrease the cases. The best way to prevent illness is to avoid being exposed to the virus in the first place. The sad truth is that there is no vaccine and there is currently no reliable treatment. There are many trials underway, though, of various drugs as well as combinations, which include hydroxychloroquine, remdesivir, there's IL-6 antagonists, convalescent serum, and the list goes on. There are antivirals. But unfortunately, none of these are completely reliable at this time. And hopefully, there will be something in the future, but at this time, there isn't. The virus is thought to be spread mainly from person to person through respiratory droplets, which are produced when an infected person coughs, sneezes, or talks. And you can see here on the left, this lady has sneezed, basically a whole cloud of respiratory droplets. And the larger respiratory droplets, which contain the virus particles, if she was infected with COVID-19, would land within about 3 feet distance from her. Some of the smaller particles may be able to fly, further and basically, would land, within about 6 feet of her. And this is why most of the infections occur between people who are in close contact to one another, so within about 6 feet. So these droplets can actually land in the mouths, noses, or eyes of people who are nearby, and possibly can be inhaled into the lungs. So the other thing which has been going around on social media and in articles as well is that COVID-19 can also become airborne. And what that means is instead of being in a droplet, which is going to drop to the ground, airborne means that those virus particles are able to float in the air. And basically that means they can remain within the air for 3 hours or even longer potentially, and they can be inhaled into the lungs. However, I have to state that the risk of airborne transmission is a lot lower than droplet transmission is, and this is more likely to occur in situations where a patient is being intubated, so they're having a breathing tube put down, they're receiving a breathing treatment. So in situations which occur in a healthcare setting, as opposed to what you might encounter in your daily interactions with other people. The scary thing is that COVID-19 can also be spread by people who do not have any symptoms of disease, or they are otherwise known as asymptomatic. Okay, so how contagious is COVID-19? The R0 is a measure of how quickly an infectious disease spreads. An R0 of 1 means that each infected person will pass it on average to one other person. An R0 of 2 means that each infected person will pass their disease on average to 2 people, and so on. The current estimate of the R0 for COVID-19 is actually about 2.2. So this means that a person with COVID-19 disease will pass their disease on to approximately, at least 2 other people on average. Just to give you a comparison, the R0 of flu is 1.3. And this is at least partly why COVID-19 spread so quickly globally. And another reason is that, as we mentioned, people who have no symptoms or who have mild disease can unknowingly spread it to others. So that brings us to what can you do to flatten the curve? So everyone should be cleaning their hands often at this point in time. You should wash your hands with soap and water for at least 20 seconds, especially after you've been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a FDA-approved hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands, rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Okay, and then everybody at this point should also be practicing social distancing. So this includes avoiding close contact with persons who are sick. You should be staying at home as much as possible and avoiding gatherings of people as well as non-essential travel. It's important to keep a distance between yourself as well and other people, and this is especially important for those who are at higher risk of getting very sick. Everyone should be covering their mouth and nose with a cloth face cover when they are around other people. You could still spread COVID-19 to others, even if you do not feel sick. Everyone should wear a cloth face mask when they go out into public, for example, to the grocery store or to pick up other necessary goods. The cloth face cover is meant to protect other people from your infection that you may have and not know about it. Do not use a face mask that is meant for a healthcare worker. Over 9,000 US healthcare workers have been infected by COVID-19 as of today. And there is a shortage nationally of masks, including the N95s, as well as the surgical masks. And many of these healthcare worker infections could have prevented if they had access to this personal protective equipment. Continue to keep a distance of about 6 feet from others, and the cloth face mask is still not a substitute for social distancing. Everyone should be covering coughs and sneezes. If you are in a private setting, such as in your home, and you do not have your cloth face mask covering, remember to always cover your mouth and nose with a tissue, or you could use the inside of your elbow, like this. Throw used tissues in the trash and immediately wash your hands, or if not readily available, use hand sanitizer. Everyone should also be cleaning and disinfecting more than usual. The virus, we know, can survive for up to 8 hours on aluminum, 24 hours on cardboard, longer, up to 3 days on countertops, plastic and stainless steel, and up to 5 days on wood and glass. It's important to clean and disinfect frequently touched surfaces daily. And this includes tables, doorknobs, light switches, countertops, phones are extremely important, desks where you work at home, keyboards, toilets, faucets, and sinks. Most common Environmental Protection Agency or EPA registered household disinfectants will actually work. But if you don't have access to any of these disinfectants, you can simply mix 1/3 of a cup of bleach in a gallon of water, and that can serve as your disinfectant. The virus is actually not difficult to kill. If surfaces are dirty, clean them. Use detergent and soap and water prior to disinfection. Launder items as appropriate if possible, using the warmest appropriate water setting, and then dry them completely. It's important to know what symptoms to look out for in case you have acquired infection with SARS-CoV-2. So these symptoms may appear anywhere from 2 to 14 days after exposure. The average, though, tends to be around 5 days. The symptoms include fever, cough, fatigue, which basically means, tiredness, muscle pains, loss of smell or taste, and shortness of breath. Not everyone will have all the symptoms. Okay, and I just put this table up here to compare some of the symptoms seen in COVID-19 compared to other common conditions, such as allergies, which almost everybody in Texas seems to have, the flu, as well as the common cold. And you can see that fever, dry cough, and shortness of breath are some of the most common symptoms seen in COVID-19. How severe can COVID-19 be? So 80% of patients who have acquired, the virus will only have mild disease, and some won't develop any symptoms at all. So they're asymptomatic. 15% of patients will have more severe disease and may need hospitalization. It's about 5% of people who will become critically ill and may actually die from their disease. People who are 65 years or older and/or people with medical issues like heart disease, diabetes, cancer, or an otherwise weakened immune system are at higher risk for getting very sick from COVID-19. So this disease can quickly progress from an upper respiratory infection, which means the patient has like a low-grade fever, they may have nasal congestion, so their noses might be stuffy, they might have like a slight dry cough. It can progress to a lower respiratory infection, which means your lungs can become involved, and this is called a pneumonia. A pneumonia can also progress to something called ARDS, or acute respiratory distress syndrome. And in this disease, fluid builds up inside the lungs and it can result in shock, and the organs are starved of oxygen. This is actually the main cause of death from COVID-19. Those who are young and healthy can also have problems after this disease. Some of them can go on to develop something known as pulmonary fibrosis, which basically means scarring of the lungs. And this can permanently affect lung function. So how do you decide if you need to be tested for COVID-19 or seek care? Not everyone needs to be tested for COVID-19. If you think you may be sick, stay home and consult with your physician on the need for testing. The CDC does have guidance for who should be tested, but decisions about testing should be at the discretion of state and local health departments and/or individual clinicians based on the current situation. Most people, as we mentioned, about 80% will have mild illness, and they are able to recover at home without need for hospitalization or more advanced medical care. They may not even need to be tested. They can take Tylenol as needed, monitor their symptoms, and use home remedies. If the symptoms worsen, then they do need to seek medical attention. However, as I mentioned, some people, like those who are over 65, those who have other medical issues or a weakened immune system, they are at a higher risk for getting very sick from COVID-19. These individuals should call their providers and likely do need to be tested. If you need help finding a doctor or accessing medical care, call 211 and they can direct you to a low or no cost provider in your area. Even if you have no insurance, you can still get tested if it is actually needed. Okay, and here I have the Department of State Health Services website, which has some useful information not only about symptoms, but also about getting tested for COVID-19. And they have actually a drive-through testing site map on their website. And when you click on the link, you can actually enter your zip code and search, and your closest COVID-19 drive-through testing location will basically pop up. Now, the testing, which is mostly performed, is a nasopharyngeal swab. And what that is that they're basically going to take a little stick, which has a swab at the end of it, and they're going to insert it into your nostril, go to the back of your nasal cavity, and then get a specimen that way. And I'm not going to lie, it is uncomfortable. That's the test that we have available for the most part at this time. There is a saliva-based test, which was recently approved by the FDA a couple of days back, but it is not widely available for use yet. Okay, so what if your symptoms get worse during the time that you're, at home monitoring your symptoms? So if you develop emergency warning signs for COVID-19, you should seek medical attention immediately. Emergency warning signs include trouble breathing, which is otherwise known as shortness of breath, persistent pain or pressure in the chest. Now, both of these things signify that your infection is likely spreading to your lungs and you're developing a pneumonia. So those are, that's a serious symptom. If you develop, or whoever's at home with you develops new confusion, or you're unable to arouse them, or they develop bluish lips or face, that's a sign that the patient might be developing shock, which means that they're not getting enough oxygen to their organs. This list is not all inclusive, and you should consult your medical provider if there are other symptoms that are severe or concerning. And, if the medical provider is not available, call 911 or go to the emergency department. Okay, so what do you do if someone in your home is sick? So the most important thing is to keep the person who you think might have COVID-19 in a separate room from others in the household. And as much as possible, if it's possible, have their own separate restroom, and as much as possible to provide them care within that room. If you are the one caring for a sick household member, you should follow the recommended precautions and monitor your own health as well. And if you become sick, it's important to stay in contact with others via phone or email. You should continue to practice everyday preventive actions, keep surfaces disinfected, avoid sharing personal items such as towels, cutlery, plates, all these things, a toilet and trash cans. They should all be kept separate for the person who is in isolation. Also, stay informed about the local outbreak situation, notify your work if your schedule needs to change, and it's very important to take care of the emotional health as well of your household members, as well as yourself. Okay, another question which is commonly asked is, when can I stop self-quarantine if I think I might have COVID-19? Or if you were tested and you were positive for COVID-19. So there are two strategies. There's a test-based strategy in which you have improvement of your symptoms and you have 2 consecutive negative nasopharyngeal swab specimens, at least 24 hours apart. But practically speaking, this is not the way to go because it's difficult to even get tested for COVID-19, let alone get tested to stop, quarantine. The more, I think, practical strategy is the non-test-based strategy. And in this, it's recommended that you should wait at least 3 days since recovery of the fever has occurred and improvement in the cough and the shortness of breath has occurred, or the respiratory symptoms that you're having. And at least 7 days should have passed since the symptoms first appeared. Okay, so I'm going to move on to the last part of the talk, which are myths versus facts for COVID-19. Okay, so the first one, COVID-19 is just like the regular flu. True or false? So false. COVID-19 is more infectious than seasonal influenza, and it is more deadly. However, although COVID-19 is more infectious, it is actually less lethal than other recent novel coronavirus-related diseases, such as SARS and MERS. I am young and otherwise healthy. I have nothing to fear. This is also false. So while COVID-19 is more likely to cause serious illness and death in the elderly and those who have chronic medical conditions, there have been plenty of severe cases and deaths in those who are young as well. Young persons also play an important role in transmission of the disease to others because they are more likely to have mild symptoms and or be asymptomatic. Warm weather will put a stop to COVID-19. So this is also false. Generally, coronaviruses survive for shorter periods at higher temperatures, but there is no direct data yet for SARS-CoV-2. We don't yet know whether weather and temperature will affect the spread of this virus. Some viruses, such as the flu, do spread more during winter months, but that does not mean it is impossible to get it during the other months of the year. And we know that many countries with warm and hot temperatures have reported COVID-19 to date. The virus can be spread through food, including restaurant takeout, refrigerated or frozen packaged food. So this is debatable. There's no evidence to support this currently, but it may be possible though by touching a surface or object, such as the plastic, around the food that has the virus, and then touching your own mouth, nose, or eyes. But this is definitely not the main way that the virus spreads. In general, coronaviruses survive poorly on surfaces, and there is very low risk of spread from food products or packaging. Ordering or buying products shipped from China will make a person sick. This is also false. There is no evidence of transmission through trade goods. In fact, with the infection rates dramatically reduced in China, with the rapid increase in cases in the US, this does not make sense. In fact, they should probably be more worried about us giving it to them. Okay, you can protect yourself by swallowing or gargling with bleach, taking steroids, using essential oils, salt water, ethanol, or other substances. False. So there is no truth to such remedies being passed around on social media. While some remedies may help with general wellness, others can actually be quite harmful. So I would advise not to forward or share such posts on social media because they cause confusion. Always verify your sources and rely on highly reliable sources such as the CDC or the WHO. The main focus that we should have is on measures that we do know improve our immunity, such as sleeping well, exercising regularly, eating a balanced diet, trying to minimize stress the best we can, quitting smoking if this is one of your habits, and then taking better care of chronic medical conditions, such as keeping your blood sugar under control if you're diabetic, controlling your blood pressure, taking your asthma medications, etc., so that when the time comes for you to fight an infection, you will have the immunity to fight it. A vaccine to eliminate COVID-19 from the face of the earth is going to be available in the near future. So unfortunately, this is also false. Vaccine trials have been started and patients have been enrolled. However, a safe and effective vaccine, if even possible, is at least 12 to 18 months away. Okay, and I couldn't possibly cover all the information which I think is needed to cover this very important topic in this time frame, but I did want to refer you to the cdc.gov website, which has a lot of useful information and answers to frequently asked questions, as well as other info. Okay, so in summary, all 50 US states have reported cases of COVID-19 to date. The cases in Texas are still rising, and we have not reached the peak of the curve at this point in time. These include not only imported cases from travelers, but or cases among contacts of known cases of COVID-19, but also community spread where the source is not known. Everyone can play an important role in flattening the curve by practicing social distancing, using a cloth mask in public, washing hands, cleaning surfaces, self-quarantining, and seeking help if there is concern for infection. Medical face masks are critical supplies, and they should be reserved for healthcare workers and other first responders. And following these measures will help to slow the spread of disease and allow our healthcare systems to effectively take care of those patients who require hospitalization. And with that, I just wanted to end by making dua for all those who are not only affected physically by COVID-19, but also those who are struggling financially, emotionally, and in many other ways, not only from COVID-19, but also from many other illnesses and hardships that we have to face. Okay, and with that, I did want to see if we could show our audience a mask, which was put up on YouTube by the Surgeon General on how to make your own cloth mask. Okay, and with that, are there any questions?
Thank you so much for this webinar. We do have a few questions here, so I'll just be reading them down the list. First question I have here is, can you explain what it means to be presumptive positive? Some people confuse the term.
Presumptive positive. Okay, so presumptive positive would mean, okay, like in the sense that you've been either exposed to someone, or if you do have symptoms which you consider, would be consistent with COVID-19, in that case, and either you haven't been tested or you're tested and you're waiting for the results to come back, that is what a presumptive positive case would be.
Thank you. Next question is, what is your opinion on the social distancing in Texas, and is it working to keep the number of people affected in check?
Okay, so I think it's still too early, unfortunately, to tell. Okay, at this point in time, it unfortunately it lags behind. So when you institute any measures such as social distancing, you're not going to see the effects of that until at least a few weeks down the line. And unfortunately, I don't think we're not following those guidelines as well as we should, and I know people are still out there who go to work, and they could potentially spread it that way. But I think it's going to take another few weeks at least before we start to see the effects of that. And in other states, actually, they are starting to see the effects now, and where the curve has sort of flattened off at this point in time from following these recommendations of social distancing.
If I get COVID-19 and recover, can I get it again?
Okay, so that is also debatable. Okay, so I mean, unfortunately, we haven't had this disease long enough to know. We don't have enough cases yet where, and you have to remember that there are different strains as well, even of COVID-19. So, I was looking it up earlier, there are about 8 strains that we know of at this point in time of COVID-19. And so, of the SARS-CoV-2. Right? So there's different strains in the virus which occurred in China versus the one which is mostly in North America. And, it's a different strain in other places. And so who knows, like, maybe if you got infected with one strain, you could still get infected by another strain. This virus mutates pretty rapidly. So it's difficult to say at this point in time.
Okay, thank you. The next question is, how do we clean our groceries?
Yeah, so I'll be honest with you. I don't clean my groceries. I don't, but I know people who, do that. And, I mean, if you want to be extra cautious, there's no harm in doing that, I would say. So, if you want to be extra cautious, and it's good to be cautious nowadays, you can remove it from the bag. You could leave the bag outside, bring the groceries in and wash them that way. Or I've seen videos where people have been sanitizing the bags and and disinfecting the bags. So I mean, there's different things you could do. I think the risk is very minimal, though, of spreading it that way, practically speaking.
When eating outside food, should we be taking any precautions?
So you always want to take precautions when you're eating outside, right? To avoid other diseases. It might not be COVID-19, but you could get food poisoning, you can get many other illnesses from eating out. So, the precautions I would take, it's always better to eat hot food, which comes sizzling off, like the grill, and you're generally safe if you go with food like that. Um, and again, the risk is relatively low of getting it from packaging, like if you're getting like takeout. But if you want to be extra careful, you could you know uh, remove it from the packaging, or you could disinfect the plastic in which the food is in. But again, I think the risk is minimal of spreading it that way.
If you could give an estimate, when do you think Texas will peak?
Mm. the big question. Okay, so I mean, it's difficult to estimate. I'm hoping that, you know, maybe by, in, I would say early May, mid May, but it's difficult. It's so spotty and it varies from county to county. So it's not even homogeneous like in the same in the state of Texas, right? So there's some places which are disproportionately more affected than others. And so I mean, I'm hoping that it would be towards, it'll be optimistic to say that it's going to be by end of April, though. I think we're going to go into May.
There's a lot of talk about plasma. Can you talk a little bit about that? And is that potentially a valid treatment, you would say, at this point?
So there is a lot of talk about plasma, and it could potentially be beneficial. The trials are ongoing, so we don't have any definite proof that it's going to work at this time. It probably would help. It probably, if you have like general, antibodies built up against a particular virus. So if you've recovered from that virus, right, and you use those antibodies and again against another patient who has the disease, it may help if they have the same strain, or if their strain is similar enough, it may help. But a lot of the deaths which occur in coronavirus are not, the reason for the deaths occurring are due to the body's own immune system. Okay, so in some cases, unfortunately, your immune system actually acts against you. And if it has a very powerful response, that can actually result in acute respiratory distress syndrome. And it can result in your, declining and actually dying in some cases. So, I think the jury is out about whether or not it will actually play out to be beneficial. But I mean, I think it's definitely worth it. And it's worth that they're looking at it in trials.
Thank you. There is another question here. I guess someone's asking to review some of the symptoms. The question is, only a dry flu without fever can be a symptom of COVID-19. So I think it might be helpful to kind of shed light on some of the atypical symptoms, some symptoms that we don't really typically hear that, oh, this could be COVID or not.
So some of the atypical symptoms which can occur, so some patients have presented with diarrhea, which is not something you typically think of being associated with like a virus that you get through the nose, right? Or through the mouth. You don't think of diarrhea. So there have been some people who presented with that, kind of like a food poisoning. Some people have actually presented with rashes as well. Which is also kind of unusual, right? Like it's not similar to the flu. They can present with a rash, and usually that's because of the blood vessels being involved, so getting a vasculitis. But that's more likely to occur with more severe disease, I would say. But you're still, the most common symptoms you're going to see are the fever, the dry cough, the muscle aches, the tiredness, and the shortness of breath. And of course, the loss in, I mean, you can get, the thing is, a lot of these are very non-specific, right? So you can, the loss of taste as well as the loss of smell, which you can get, that can occur with many other infections as well as allergies. So it's very difficult to differentiate it from others.
So as we are all indoors and staying at home, what are some resources or ways to achieve wellness and optimal health staying at home?
Yes, so I'm glad that I actually purchased an elliptical right before all this started. So I mean, if you have any means to exercise at home, that would be, because most of the gyms are closed. And anyway, even if they were open, you shouldn't be going to the gym right now. So find a way, an exercise routine. You could still go walking outside. before it gets too hot. You can go outside and kind of just walk. Keep your distance from others, though. You could do yoga or whatever exercise you like to do just to stay active. Sleep well. You can meditate. You can pray. Read dua. All of these things help to calm the mind. Um, Eat well. So, I mean, this is no excuse just because we're all stressed out sitting at home. We should not be going to the fridge every, 20 minutes. We should try and keep a check on how much we're eating, so we don't gain too much weight while we're in quarantine. And, just eat a healthy, balanced diet. I think those are the most important things. And try to reduce your stress, sleep, and, sleep well as well.
After we peak, how important is it to still maintain social distancing?
Yeah, so I saw a study recently, actually not a study, but I just saw an article, an opinion that, to some degree, this may, I hate to be so gloomy, but this may go on for several months, even potentially years, for all we know, COVID-19 could be around for a long time. So I think to some degree, we're going to need to practice social distancing to some degree. It might not be, that we need to be at home necessarily and all that, but, probably for months to come, I think, at this time.
Okay, and I'll wrap it up with this last question here. Someone has asked, how can someone with a medical background from outside the US help in this crisis? Or I guess anyone for that matter with a medical background.
Oh, with the medical background. So, I mean, the world is just so even when all these travel restrictions are lifted, I think, it's just the world is just such a small place now. It's easy to for the virus to travel so quickly from one place to another. Within 24 hours, you can have a virus all the way from, China to the US or from across the world. So, I mean, I think once this travel restriction kind of opens up, I mean, there will definitely be ways to collaborate. I'm trying to think of how they could help at this point in time with the crisis. Um, Nothing really comes to mind, I'll be honest with you, at this time.
Thank you so much once again, Dr. Annie Kizilbash. It was a very enlightening session. And to our viewers, thank you so much for joining in and tuning in tonight. I just have a couple of reminders before we end the session tonight. Tomorrow, April 16th, we have Tafsir of Nahjul Balagha with Sheikh Amin Rastani, Dua Komel, and Tafsir of Nahjul Balagha. And then Friday, April 17th, we will be having a session with Sheikh Jaffer, Coping with Stress in a Stressful Time. So please make sure to tune in and don't forget, stay home, stop the spread, and save lives. Thank you. Iltimas dua.